Knock, knock, knock. Hi, Hannah. My name's Kinsey. How are you feeling today?
I'm doing okay. I'm a little short of breath.
Okay. Well, I have something to help you with that. I just want to make sure you're comfortable, you're sitting up in bed. You don't need anything before we start?
No, I think I'm okay.
Okay, well, I'm going to go close the door. I'm going to turn the lights on, make sure that it's nice and bright in here so we can talk about this thing, okay?
All right.
Okay. All right. Have you ever heard of something called an incentive spirometer before?
Yeah.
I know the nurse, who was the night nurse, brought it in and kind of explained it to us, but I'm still a little confused.
So I have this thing here. This is what you call the incentive spirometer. And then I also have a little pamphlet to take home that you can read through if you have any more questions after you get out of here, okay? Okay, so how to use this thing is this little blue thing comes off like this. You're going to sit up real nice and tall, real straight. Seal your lips around this little blue mouthpiece. You're going to slowly inhale a breath as long as you can. You're just going to go real nice and deep.
Okay, so I sit up straight and then I'll put the blue in my mouth and breathe in really slow.
Yes, like you're sucking in a big, thick milkshake.
All right.
And then what we're gonna do is we're gonna try and keep this little yellow thing here in the best area. So that's as long as you take a big, long, deep breath, that'll keep it there, okay? And then I want you to repeat this 5 to 10 times every hour that you're awake.
Okay, so the yellow thing that moves when I breathe in, and I want to keep it in the best area and 5 to 10 times every hour.
Yes, that you're awake. If you're sleeping, you don't have to wake up in the middle of the night to do it. So with doing this, that will open up your airways, clear that mucus, and kind of allow more oxygen to come in. And that'll help you get out of here and recover a lot quicker, which is what we want to do. Okay, well, I'm going to hand this to you. And I'm going to have you kind of demonstrate how you're going to use it, and I'll talk you through it, okay?
Okay.
All right. So you're going to sit up real nice and tall, real straight. Put that blue thing in your mouth. And then you're going to take a long, deep breath in. Perfect. And then you can exhale. Good. And now you want to repeat that about 5 times, okay?
Okay. Can I try it on my own without you so that I can make sure I know how to do it?
Of course. And if you need any help or have any questions, I'll guide you along the way, okay?
So I grab it.
No, I know how to, I just don't know what to put in.
Perfect. That's just the way to do it. And then as you use it more often, you'll be able to go higher up and see that little thing move in there.
And I know we're hoping that my sister will be discharged soon. Will we be able to take this home with us?
Yes, you can take it home and you can use it as often as you would like. It's just going to help you feel a lot better.
Okay.
Okay?
Can you help remind me when to use it too, just in case
Oh,
I
of
forget?
course. I'll take care of it. Don't worry.
Perfect. I love that you have a good support system to remind you. All right. Well, are there any questions that you have for me that you think we should address?
I don't think so.
Okay. Is there anything I can do to make you more comfortable? Are you doing pretty okay?
I'm good for now.
Okay.
Thank you.
You're welcome. I'm going to give you this little pamphlet to take home. That way you have pictures, you have everything that you need. And if you have any questions, you can always give us a call, okay?
All right.
Thank you.
So this is our pamphlet for the incentive spirometer use for pneumonia. So we gave this to the patient to help them understand the use of incentive spirometer. It's also a tool that they can bring home with them in case they forget while they're at home after discharge. Some strategies that we use to address the health literacy factors include making sure the patient was comfortable so that they were ready to learn about incentive spirometer use, and then closing the door and turning on the lights to make sure that they could see the pamphlet well and hear the nurse talking. In our pamphlet, we have lots of visuals that can help paint a picture of how to use it for the patient, and then we also made sure to use simple words that all patients would understand regardless of their literacy level.
To describe the use of an incentive spirometer, we related it to familiar situations like breathing or like sucking through a straw of a thick milkshake.
And with this too, one thing that an alternative that we could use for, let's say, someone that does not speak English or cannot read English, we could provide this pamphlet in whatever language that their native language is. Or another way that we could do this is transfer this onto some sort of technological device, such as an iPad or a computer, to where if a blind person needed to understand this material, we could convert that into a text-to-speech method in order for them to be able to understand and learn.
The last strategy that we used were different teaching strategies, such as the teach-back method and the demonstration method. This means that after we had talked to the patient, we allowed them to teach back what we had just taught them. The other method that we talked about was the demonstration, so allowing the patient to do it by themselves and allowing them to ask any questions that they have after that.